Welcome to this episode of the Holistic Woman podcast with your guide, Kate Payne. Today I have Kathryn Jones from Eastern Osteopathy, the Osteopathic Pelvic Hub, the Osteopathic Pelvic Health Institute of Australia. And Kathryn is an osteopath, of course, one of the most highly trained in Australia in pelvic health and pregnancy, where she has studied under some of the most renowned physiotherapists here in Australia and also overseas. Her training comes from physiotherapy, science, and research, but her osteopathic mind and hands allows her to have a holistic style of pelvic health. Welcome to the show, Kate, and this is exactly why I wanted you on here, because of this holistic style of pelvic health. So welcome.
Thank you so much for asking me. I'm really excited to be joining you today. I love your podcast, so yeah, thrilled to be here.
My pleasure, and I love your work, and our paths have crossed many a times. I think we were first introduced through your sister, who's also an osteopath and one of the co-founders of the Osteopathic Pelvic Health Institute of Australia. And we met through one of my absolute soul sisters, colleagues, and someone who I've created many trainings with, Andy, who's also another women's yoga therapist. And the work that I've seen unfold from you over the past few years, particularly around this area of women's health, I think is so inspiring and so needed in the world of Western healthcare. And then having that, like you say, this osteopathic mind and hands approach, or through this lens of osteopathy, which we know is all about holistic health, is just so powerful. But before we dive into all of that good stuff, can you start by sharing the season that you're in? Because you're a mom, you're a woman, all the things. How are you celebrating where you're currently at?
Well, in terms of the seasons, I am going through many. I'm menstruating. I'm a mother. I'm postpartum. And judging by the way that my periods have been going over the last few months and being the age of 45, I hate to say it, but I feel like I'm sliding into the perimenopause. So hoping that was going to be a little bit later in my life, but I feel like that's coming sooner rather than later. And I guess for me, of all of those seasons, the one that I identify with the most is motherhood. I don't consider myself in the postpartum period. I sort of feel like I'm going pretty well in that respect, and I'm still menstruating, and I talk to my girls a lot about that, but it's the motherhood. And I guess for me, celebrating motherhood is just without guilt, allowing myself to have that time and space to have a meditation practice and mindfulness, and giving myself time. I've just recovering from from back surgery last year, but I've just even recently given myself permission just to start doing exercise again at a gym. And but the meditation part for me, without that, I mean, I'm a better mum because I give myself that time to meditate and clear my mind and the mindfulness. And I'm trying to interweave that into my family as well. I'll ask my family, what were you grateful for today? My partner hates it. But the girls will sit down and talk about what they're grateful for. So I guess that's my way of celebrating it. It's just giving myself time and permission and not feeling guilty about it, because I'm a better mum when I do it.
Yeah, I agree. I also have a daily meditation practice, and it definitely, fuels my nervous system in a way that allows me to, stay calm and really grounded. And I think it's so important that as mothers, we have that space, and it doesn't have to look like meditation. As we both know, it can look like anything for any woman, whatever she feels aligned to, but to have that personal space every day to be able to tune back into our body and our breath and become, more aware of our life as a woman. And then it is that acknowledgement of the seasons. Has it always been like that for you, or has it shifted since you became a mum?
I think that, I was a typical mum, and everything was about the family, and I gave myself the time to start off with. And I think it's a real juggling act, just try and, before I had kids, it was all about my fitness and my meditation and so forth. And then all of a sudden, when you needed it more than you ever have in the past, and you needed to have that time to yourself, it was that juggling act of trying to find the time to yourself. So it took me a few years to actually find my groove with my meditation and prioritizing that over well, no, I wasn't prioritizing it over my family, but I was just prioritizing it as part of something that I needed to do on a daily basis.
Yeah, I prioritize it over my family.
Well, the other day I'm sitting in the middle of a meditation and I put my AirPods on so I can't hear what's going on around the house, because just my house is pretty open, and my daughter came and sat on my lap and she grabbed my face and she started doing the Eskimo kisses on my nose.
Aww.
And I was just like, stuff the meditation. I just want to be
Yes.
right now. And,
Yeah.
I picked it back up later. But in that moment, I also was like, well, the reason why I'm doing the meditation, or part of why I'm doing it, is so that I can be more present.
Exactly.
And so for me, in that moment, I wanted to be present with my daughter, and I wanted to be giving her Eskimo kisses back. And then, we settled into a nice pose that meant that I could hold her and continue with my meditation. And you adapt as well.
Yes, I agree. And I think that's why I think women have such a challenge in prioritizing themselves. And I don't think it needs to be one or the other, but I think we have to be able to prioritize ourselves as women, and particularly as mothers with young children. Otherwise, that outward pouring of energy is very one way, and it needs to flow back inwardly as well. And like you've just so beautifully articulated, when we feel fueled, then our time with our children is so much more rich, and they really get the best of us, and then we get the best of us, and everyone wins in that situation. But sometimes just at the beginning it's a bit tricky. I have a lot of clients I'm working with at the moment who are just in that really tricky stage of making it themselves the priority, and then starting to build that habitual patterning of, yes, mum has this time for her, she goes for a walk, when dad gets home, and or whatever it looks like, and then over time that just becomes part of their normal routine, and it doesn't feel like she constantly has to ask for her needs to be met over and over and over again, because it kind of is just the way family life works.
And it's so much easier when you have a partner that is really supportive. And my partner is very supportive. Like, I went to the gym the other morning and I got home at 7:30 and I was like, oh, I've got to get 2 girls ready in an hour. And I walked in and he had made the lunches, the girls were eating their breakfast. So all I had to do, because he had to be gone in 10 minutes, all I had to do then was get the girls dressed and get myself ready in an hour, which is time for me because I'm not high maintenance. So it does help when you've got a partner that's supportive as well. But
agree. Yeah, agree. Very important. I want to touch on your work now. So your work is centered around women, and on your Instagram profile, you speak to it as being a heart-centered pelvic health and birth work approach. Can you share what that means to you and why you think that's so important in being able to meet the needs of women in this modern day?
Yeah. So for me, it's not just even when I'm working with patients that I feel like I'm heart-centered. I try to bring that into the running of my business and the way that I react, the way that I interact with the people that work with me, whether it's the other osteopaths or the reception staff. I want that to be a part of all of what I do. And when it comes to my patients, it's about compassion, and it's about truly caring. And I feel like that's exactly where I come from. Like, I will cry when a patient comes in and tells me that they've just been intimate with their partner for the first time, because I feel like that is just a God-given right for everyone to be able to be intimate with their partner and it feel good and it not be painful. And when someone comes in and tells me that they're pregnant, so for me, I feel like it's truly caring about my patient's story. It's about truly caring about their outcomes. It's truly caring about their goals and where they want to go and where they're hoping to go. So it's all about compassion and truly caring for me about my patients.
And it sounds like, that's how it should be, right? That's how it should be. But as we both know, it's often not like that. It's often the opposite experience for many women. Why is it so important that women access and find practitioners that feel really aligned and really have that heart-centered approach? Why do you think that's particularly important for women who are moving through like the pregnancy and birth and postpartum?
Well, so there's research out there that actually says that for many women, they feel like they're not being heard when they go and speak to a practitioner. So
Mm.
for me, it's about just sitting and giving them time and space to actually feel like they've told their whole story and that you've actually listened to their story.
Mm-hmm.
And when someone's coming in to talk about a birth and why they're wanting to prepare, but then they're also touching on a trauma or a past birth trauma, or they're postpartum, they're coming in for the postpartum period and they're talking about the birth experience that they've just had and how, whether it was positive or it wasn't positive, I think that, you know, having that ability to be really compassionate and really care about what they're saying. And I will sit there and I will listen for 5 minutes and I will not say a word to my patients, because I want them to be able to say everything instead of trying to give them advice and jump in at any point, interrupt and tell them, you know, I just want them to sit down and tell me the whole story and feel heard and that they've been listened to, because it's, for some women, it's really hard to come in and talk about these things. And, you know, it brings up lots of different emotions, and we need to just sit there and just be good listeners and hear the whole story.
Yeah, that to me reminds me really of this osteopathic approach to see the whole, you know, the woman in her wholeness, in her entirety, and really offering not just the, you know, the medical advice and support, but also offering a listening space and holding a safe container for her to feel heard and be able to express. Can you talk, for those maybe who are listening who don't have a full understanding or concept, or maybe they've never even heard of an osteopath? Like, let's hope they have, of course, but if they're listening to this podcast, they likely have, for sure.
Yeah.
But can you speak a little bit more about the way you've taken the osteopathic lens and you've taken then all of this rich knowledge and experience in pelvic health and combine the two to create this really holistic approach?
Yeah. So for me, I've been an osteopath for 20 years, and I started getting into pelvic health probably 7 years ago. And when I first started doing pelvic health, it was the model that the physios generally use, and not all physios, because I know that there's some great holistic physiotherapists out there. They have a model of, when they're doing an internal pelvic floor assessment, it's usually, you know, they insert a finger and contract, relax, and you're tight, do these exercises, you're weak, do these exercises. And so that's what I learned. So I brought that into my practice, and I was doing it going, what in the heck? This does not fit right. This doesn't sit right for me. I would never look at someone's shoulder and go, oh, you're restricted in this movement, strengthen it here, or you're restricted, or you're a bit weak, just do this exercise. And I was like, why are we giving less respect to the pelvic floor when, if you ask me, the pelvic floor deserves more or just as much respect as any other part of the body? So I started just going, asking the why. Why is it tight? Why is it weak? Why isn't the pelvic floor functioning right? And going, well, if the traps are not moving very well and someone gives it a massage, how much better does it feel? Well, you can't get your whole hand in there and massage the pelvic floor.
Yeah.
There's lots of really gentle myofascial release techniques that I will do to get the pelvic floor functioning better. And inevitably, for most of my patients, at the start of the treatment and then at the end of the treatment, the pelvic floor is functioning so much better, because we have balanced the pelvis. And we have, if the rib cage is not moving very well and they aren't able to breathe very well, then obviously that's for I'm sure at some point I'll explain the relationship of that. But, you know, we're looking at that whole body. If the foot's not moving very well, and you're not absorbing shock, then that increases the load on the pelvic floor. So we're working on the foot, we're working on the pelvis, we're doing internal myofascial release work to the pelvic floor. But we're also then going, well, if the person has a tight pelvic floor because of a previous trauma, then that needs to be addressed. So if they've got a lot of anxiety, and so it comes into that whole, we like to look at it as a whole person approach. And I know that yoga is very much about that as well, because everyone can do whole body. That's an easy thing. But to look at the whole person and go, okay, well, your pelvic floor is actually really tight because of your anxiety, and your anxiety is driven because of relationship issues, then no matter how much myofascial release work I do to the pelvic floor, it's going to come back. It is then looking at that whole body and that whole person, and working out, okay, well, we're addressing sleep and we're addressing stress, and we're looking at the pelvic floor and so forth. So it is the whole thing, the whole body, the whole person.
Yeah. And it takes more than just one session then.
Oh,
It's not something that can happen in, and I think when we it's just I just love speaking about this because the holistic approach and practitioners like yourself really bringing in that holistic lens and seeing the woman in her entirety and supporting her over a period of time to cultivate that whole body health and healing for herself is so powerful. But in our Western kind of mindset and the way we've grown up and been conditioned is that you go and see a health practitioner when you're in a state of illness or disease and they support you. You know, you go like that shoulder example you gave. I've got a sore shoulder, I go and get a treatment, it feels better, and I continue on with the rest of my, the rest of my life. And then when that crops up again, I make another appointment, I head back. But what I'm hearing from you and what I know of your work is that you're actually supporting women really across like the whole continuum of their life, because we're saying that the pelvic floor and pelvic health is impacted really by so many different like day-to-day living for women, right? So you actually become this kind of partner for women to keep kind of circling back to and checking in with as they move through different transitions and seasons in their life. And you become this really, yeah, like this partnership. It becomes this collaboration rather than this practitioner that you just go and see when you have like a bit of a soreness or an injury. Would that be fair to say?
Oh yeah, absolutely. And I don't even, I mean, we spoke before we got started about calling me the, doctor, and I'm like, oh no, I don't want the doctor part. Like I love that relationship is, I feel like for me personally, I get so much out of helping my patients as well. So yeah, you do create a partnership. And for many, it starts with preparing them for birth or helping them to actually be able to have sex. I'm working with a patient at the moment. I've had plenty like this where we've got her to the point where she can be intimate with her partner, and then she's getting pregnant, and then we're going to help her prepare for birth, and it just follows on. So you end up being very invested in the person and in the patient and in the future mum, because you've been there that whole story, and sometimes you've known them longer than they've known their partners. That's how long some of the relationships have gone on. You're helping them, and then they met the person, and then they're pregnant, and so, and I love that part of the story.
Yeah, that's amazing. What was the catalyst for you moving into this kind of work? Because last week when we were meant to record the podcast and needed to reschedule, we were talking about how you were working in sort of, your typical kind of osteo clinic setting with, and I know when I was living in Melbourne and my husband and I had our own clinic, it was the very typical, white collar, sore necks, sore backs. That was pretty much, the crux of it, injuries, people hurting themselves at the gym, that sort of thing. And you were talking about how that not being as fulfilling over the years, the longer you're in that space, the kind of less fulfilling it becomes because you're seeing the same kind of thing day in, day out. And so what was the catalyst then for moving into working with women in this way?
I can remember when I graduated, like I said, 20 years ago, all of my friends wanted to get into pediatrics.
Okay.
All I wanted to, and most of them did, they all went down the path of doing more peds. All I wanted to do was work with pregnant women. I wanted to help women who had headaches around the time of their period. That's all I ever wanted to do. And it was probably 15, maybe 17 years ago was the first time I tried to do a pelvic floor course with a physio institute here in Australia. And I sent my check off and I was so excited. And my mum was a continence nurse. She sent her check off. I wasn't keen on doing the course with
with your mum.
With my mum. But I was excited about doing the course, and they just sent my check back and said, really sorry about your cards, you can't do it. So I just kept trying and trying. So even though I've only been in this field for 7 years, which is still a long time, I tried so hard for so many years. And then it was about 7 years ago, because I was pregnant with my daughter and she's 6. And she was born in December, so it was almost 7 years ago to around this time. Actually, we finally got onto a physio course here in Australia, and then we did the rest of our training in America, because even though we got on that course, we weren't allowed to do any more of their courses. So we then started doing our training in America, and my sister and I did the full range of courses in America that you would do to become not a specialist, because I'm not sure if, like, I know here in Australia we can't call ourselves specialists, but like a pelvic floor physio over there. So when I started getting into then pelvic health, I put all the information on my website. And I thought it was going to be pregnant women, and it was going to be postpartum, and it was being incontinence, prolapse. That's what I was going to see. What I didn't realize was that they're not the people up late at night, generally speaking, Googling something different. And it was actually the chronic pelvic pain. So when I got into pelvic health, I didn't go into what I thought that I was wanting to do. And my most passionate thing is pelvic, is preparing someone for birth and pregnancy. But I all of a sudden was treating vulvodynia and vaginismus and persistent genital arousal disorder, because they were the people up late at night going, what in the heck? I need something. So I dove straight into the chronic pelvic pain. And I guess that's where my real passion for helping people with intimacy and being able to have sex again came from. It's because I had so many patients coming in where it was a 2-3 years since they'd even been intimate. Some of my patients have been married for 2 or 3 years and not even being intimate with their husband. So that's what I went straight into. Once I started getting a reputation, that's when the patients with incontinence and prolapse and pregnant people started coming to me. And that was probably about 4 years ago. So and I'm lucky enough as an osteopath to completely close my door to general osteopathy. I don't take on new patients unless they are pelvic health now. So that's all I do all week is just pelvic health. And even though as soon as I got into pelvic health, in reflection, I was like, I had lost a bit of the spark for what I was doing in that moment, in the time. I didn't realize that I had. It wasn't until I found this new line of what I was doing and the different people that I was helping, and the impact that I could have on this group of women, on these women. And I treat men as well, but I have to admit it's probably 98% women. But I'm okay with treating men as well. I'm not opposed to treating men. But yeah, so I just I fell in love with it.
And that then what was the catalyst, you having to go and train in the US? Was that the catalyst then for you co-creating the Osteopathic Pelvic Health Institute?
No, it was complete selfish reasons for completing the institute. I was booked out 3 months in advance. I needed to train the osteopaths that worked for me, and really needed to be in an official capacity as well. And I also want to get it out there because I truly believe that osteopaths can and will make some of the best pelvic health practitioners because of our holistic way of looking at the body, and don't just give someone exercises. And I know that there's a time and a place for that. I'm not taking away from people that do just that, but my training, like, there's just so much more to the body. And so I also wanted to get it out there. I wanted to get osteopathy and pelvic health out there, but it was also because I just needed help in my practice, and I just needed to train the osteos that work for me. And a lot of really good osteopaths gravitate towards my clinic because they want to work with me, and they want to learn from me, and they want to see all the patients that I'm seeing. So I have an amazing group of osteopaths working for me. So I was able to train them up. But at the same time, I think we've trained about 75, 80 osteopaths in pelvic health across Australia. A majority are in Melbourne, but there's some in nearly every state, which is amazing. So hopefully over the next couple of years, you'll start seeing more and more sort of osteopathic pelvic health clinics popping up everywhere.
Incredible. And it's only for osteopaths?
At the moment, it's only for osteopaths, mainly because there's, like, every course that we do, there's a wait list. So we are wanting to get just the osteopaths trained, but we have chiropractors, midwives, and even a lot of physios, because there's still plenty of physios that want that more holistic approach.
For sure.
And they want to learn how to do what we do in terms of all the different internal visceral techniques, because I will be doing techniques to the cervix, to the bladder. So one finger's internally on part of the fascia, or at the trigone at the base of the bladder, and then externally I've got my finger on the bladder and doing a myofascial release between the bladder and the fascia that surrounds the urethra and up through into the trigone of the bladder. So they want to learn those techniques, and when it quietens down with osteopaths, I'm sure we will open it to other professionals, but at the moment we're just filling it with osteopaths, and that's our priority.
Yeah, yeah, amazing. I want to talk about supporting women and what that looks like from your perspective, how you would work with a woman, and obviously understanding all women are different, but to take us on a journey from a woman coming to you who has chronic pelvic pain, is not able to be intimate with her partner, all the way through until postpartum. What are you focusing on in terms of her pelvic health and her overall well-being to take her on that journey?
Well, I guess it completely changes through all the different stages. Because to start off with, if someone comes in and they've got something like, to say, dyspareunia,
Mm-hmm.
or which is a blanket term for painful intercourse,
Mm-hmm.
we're working on that whole person. I'm going to tell you one piece of research, because it changes everything in terms of even how you help prepare someone for birth
Mm-hmm.
versus how you might help someone to be intimate with their partner. They do, so just for the people out there, vaginismus is a condition, and for many it's a debilitating condition where the pelvic floor muscles automatically engage with any form of vaginal penetration, and that can be a penis, a dildo, a finger, a tampon, a speculum. It doesn't matter what it was, and it can be different for everyone. It could be any form of penetration for some, and for others it's just a penis, or it's just a speculum, or just a tampon, or, and not even just, it is only a penis or a
Yeah.
tampon. And so they had this group of women, and the people who did the study truly believed that the pelvic floor contracted inappropriately, and it will probably have something to do with sex.
Mm.
And so they put electrodes on all through their vagina and so forth, and up through their neck. And then they had the group of women without vaginismus, and they showed them a sexually erotic movie, a sexually threatening movie with rape scenes. They showed them a scary movie, and then they showed them a neutral, natural, something a bit like Friends, just something easygoing. What they really were not expecting was this group of women contracted their pelvic floor, and it had nothing to do with sex. I think every woman out there is going to say, yeah, I could have told you that. You didn't need
Yeah.
to. And it had everything to do with feeling scared, threatened, anxious. So it had nothing to do with the erotic movie, and but the rape scenes elicited women to be contracting their pelvic floor. It was scary movies. We were contracting our pelvic floor. And they were not expecting that. They 100% thought it would have something to do with sex.
Yes.
What they really were not expecting was the group of women, the control group, did the exact same thing.
Yes.
And that's when they realized that the pelvic floor is an emotional muscle, and it contracts, and it's a defensive muscle, and it contracts when we're scared, and when we're anxious, and when we feel threat, and when we're in pain, and all of those things, our pelvic floor contracts. So when we're being intimate with someone and it's painful, of course the pelvic floor is going to contract. So, but it's also working out, look, well, why is it tight in the first place? And where's that fear come from? Where's that anxiety come from? So it's that holistic whole body thing. And that goes through the whole cycle of someone going from wanting to be intimate with a partner to being wanting to get pregnant with and then postpartum, because they need to calm their nervous system down, work out the why is it doing that in the first place. And so we're trying to work out the why, while we're also helping to decrease the local tension as well. So that goes through to help someone be intimate with their partner. And then through birth, it's so important, because your pelvic floor has two roles during birth. One of those roles is to have good even tension, and that good even tension, when the baby's head hits the pelvic floor, that even tension flexes the baby's head, and by flexing the baby's head, the smallest part of the baby's head is now presenting to go down the vagina. Now, I'm sure I can speak for every single person here or anyone that's about to have a baby. We all want the smallest part to present. No one wants the biggest part. So you need good even tone. The pelvic floor then turns the baby's head. Then it needs to also be pliable and flexible and distensible, so it can get the hell out of the way, and it just then moves out of the way. So it's got an active component and a passive. So the active helps to move the baby's head, and then the passive part helps to get the baby's head out of the way. If you are living in a life of fear and stress and anxiety, it is going to be so much harder for that pelvic floor to get out of the way. So then we're still weaving that whole, any previous stress and trauma and so forth, even into the birth. And for some women, it could be just as simple as their fear or anxiety is about the birth. So it might not be a previous thing. And so it's still weaving that whole thing through the preconception to actually birth, and then postpartum as well. Like, we need to be able to, you know, a lot of people have stress and anxiety after birth as well that can impact the way that the pelvic floor is functioning.
So are you giving them tools and ways, like techniques to take into the birth portal with them to try to, in essence, regulate their nervous system as much as possible?
And I know that you know the answer to this, but it's the breath. And I say to patients all the time, your breath, it is the most important tool you can take into the birth, and you can't forget it. You can't leave it at home. You've always got it with you. And I guess it's working with them, because it's no point telling a person or a patient or a mum, a future and soon to be mum, to bring your breath into birth. They need to be practicing it. They need to be aware of it and knowing how to connect with their breath throughout the pregnancy, so that it's familiar with them and they can tap into it really easy. And they know how that they can use their breath to deal with pain. They know how that they can use their breath with visualization techniques to soften the pelvic floor. They know that, and it can be, the more that they've used it in the past, the easier it is for them to tap into it, to calm their nervous system down, to, you know, and then they're bringing in vocalizations, you know, humming. I don't know if you know this, so excuse me if you do, but I'm sure lots of your listeners might not know this, but your vagus nerve, and your vagus nerve helps to calm your nervous system. It goes through and around in close proximity to your vocal cords. So when you hum, it helps to calm your nervous system down. So how many women do you know that when they're in labor intuitively will moan and
make sound,
and they make sound? And it's those, and every yogi and enlightened person and anyone that's meditated goes om. I mean, that vibrates. You feel it as soon as you do it. You can feel the vibration. That helps to calm our nervous system down. We've been using it for decades and centuries and millenniums, however, like for a very long time. But it's educating your patients on how they can even use techniques like that to help calm their nervous system down and so forth as well.
Yeah, it's why I love mantra so much, because it's why my prescription would be for every woman to learn mantra. And I don't know the scientific, you know, I'm sure there hasn't been, like, you know, much, if any, specific research on this, but maybe you know of some of women who find it challenging to use their voice. And I know when I share yoga with women, oftentimes it's really easy to do something like a bumblebee breath, because it is just that humming, and it's something that maybe we've done since we've been a child. But to vocalize sound in the form of mantra, even for om, can be really intimidating for women, and they're just kind of like, oh no, I don't want to share my voice in that way. And then I wonder that, like, I just intuitively feel like there would definitely be a correlation then to the emotional state and the physical state of their pelvic floor.
Oh yeah. And like, so even little things like when we do low toned noises, that helps to relax our pelvic floor. So the nervous system and the pelvic floor are just intertwined. Nearly everything that you do to calm your nervous system down also calms and helps to relax your pelvic floor. So, and it comes back to learning it too, because I know that when someone is in birth, if they're embarrassed to use their voice, they're probably not going to do it. So I get my parents to practice that and practice it with their partner. I want their partner to be doing it, so they're not sitting there alone doing it. And for me, I can remember with my second birth, the noise that came out of my mouth felt tribal. I didn't practice that. It was innate.
Yeah.
So for many of us in birth, if we're having a birth that is well supported, we feel safe, because there's a big difference between, I truly believe these noises wouldn't have been coming out of my mouth if I didn't feel safe. But I felt like there was a ring of women chanting my name when this was all happening. And I can remember thinking I would I would normally be embarrassed for this noise to be coming out of my mouth.
Mm.
And I'm going to do it for you right now. So every woman out there that's preparing for birth,
Oh, please do.
And you can go that it's nothing to be embarrassed about. And I know it's easy for me to say this, but I'm doing it on a platform where there's lots of people that potentially will hear this. But it was low and it felt guttural, and it was like, it was low, and it was, and that was helping my pelvic floor. It was helping my nervous system, all of the things. So it's practicing it. It's practicing it before you get into birth, and visualization techniques as well. And I know you probably know all about the benefits of visualization techniques. But when we visualize an activity, it's perceived and it goes to our motor cortex. And your motor cortex, like it sounds because it's motor, is also the same center that we do an action with. So the more that if you're preparing for birth, the more you can visualize this baby coming down into your vaginal canal, the more you can visualize that your pelvic floor is softening and relaxing. And the more you visualize those things, the more your brain will be able to tap into that, because it's a learned behavior for your brain. It's your brain has done that 100 times because you visualized it 100 times as well.
And it's tapping into the feeling as well, of that visualization. I was recording a podcast yesterday about a woman who specifically works with birth trauma. So she's a psychologist and counselor, and she works with birth trauma. And she was talking about taking women through the birth portal. So if she has the opportunity to work with women before they move into birth, about the visualization component as well, and how oftentimes women may find it difficult to describe how they might want to feel during birth, but when they can look through a series of images, it evokes that emotion and that felt sense. And so then they say, oh, that picture makes me feel like ABC. It makes me feel safe and supported. It makes me feel empowered. It makes me feel strong in my body. And so they take that visualization of the image, which is exactly what you're describing now. And I think that's so important when you move into the birth portal, from my own experience, and then also with women that I've worked with. When it doesn't go to plan how we would perhaps like it to, there's that felt sense that we can hold on to. So even if it doesn't look like we want it to in the external, that we've got the felt sense of how we want it to feel. So when I went into my second birth, the plan was to have a VBAC. Didn't quite work out that way after 30 plus hours of labor, and really needing that additional support. And so making the transition to the hospital, and ended up having a second C-section. The feeling that I wanted to feel was empowered, in control, in my own body, in my, being able to make informed choice, being able to ask for what I needed. All of those things I was able to tap into because of all of the work that you're speaking to, even though externally it looked very different to what I had envisaged this birth to look like. And I think that's so important. So everything you're talking about just transitions, no matter what it looks like specifically.
I got goosebumps when you were talking about your birth then. And I think it's really important that for people to realize that a positive birth can look so different. It doesn't have to look like a vaginal birth.
Yeah.
It can look like an unplanned cesarean birth. That can still be really positive. And it's about working out with your birth plan about going, well, if I do have to, because we have to be flexible and adaptable with birth.
Yeah.
And if it is going to go down that path, how can I still make it a beautiful birth? And I know it's easy for me to say that, because for some people it can be really devastating. But as much as possible, we need to sort of be able to also go, oh, how can I still make this the best birth possible? And there's always going to be people that have birth trauma, and it just doesn't work. That doesn't happen for them, and it's not a positive experience. But I think it's good to remind ourselves that a positive birth can just look really different.
Yeah, absolutely. And you've shared a lot across your Instagram account around C-sections, which I love, because it's something that it isn't spoken about as regular as vaginal birth. And oftentimes it's associated with the narrative of trauma. And having had two C-sections now, I know that my first one was very traumatic, but I also didn't have a lot of these tools and understandings of birth and understandings of the nervous system like I do now. But certainly did when I went into my second birth. So I was able to take all of that information and wisdom with me and practice, but also, of course, the embodied experience of already having had a C-section and how I would want to have, it slightly differently. But what makes you so passionate about sharing information about C-sections?
Yeah, because most of the people that I know on social media that share a lot of information about cesarean births, they've all had cesarean births themselves, and I haven't. But I feel like they're forgotten. Like, and to me, they've still given birth, and I really am so passionate about calling it a cesarean birth and just reminding people that they gave birth. And I have people come in all the time, and I'll listen to their story, and they're talking about the cesarean, and they called a C-section, and they talked about it like it was a medical procedure. And I'm lucky that I didn't have a birth like that. But I just want every woman to be proud of their birth. And I also see how it's almost like people just think about the sort of prolapse and incontinence as a thing that you've got to recover from birth. And I've had patients come in who I've done work on their cesarean scar, and their body would not move until I did work on their cesarean. Essentially, this one lady, and her hips just went from not moving to completely moving after doing work on her cesarean scar. And I said to her, I can't remember, how old was your daughter when you had this cesarean? And she's like, 34. 34 years she'd had this tension in her scar.
Wow.
And I was in one session, I was able to work through her scar, and it completely changed her hips and her low back. And I think that was the moment that I went, I need to be doing more of this. Why isn't everyone doing work on a cesarean? Why are we not all asking and working on that? We preach about pelvic health, but why it just seems like it's missed, and it's major abdominal surgery. You cut through 7 different layers of fascia and tissue to get to the uterus. 6 months after someone has given birth via a cesarean, their uterus is still remodeling. I truly believe that there just needs to be more care given to women who've had a cesarean birth, but not just their physical stuff, but also the mental, and if they do have some trauma associated with it. But I'm also really big on, if a patient comes in and says, I have to have a cesarean. Like me, I'm like, okay, great, let's make it beautiful. Yes. And every time I talk about the cesarean, then it is, okay, it's going to be a beautiful cesarean. What do we want? We still want dim lights. Can we do this? Can we do that? Deep cord clamping. And I'm sure you had more of an idea of what you would want for your second birth. So you're probably able to have skin and try to breastfeed straight away and all of this. And one of my favorite things is when a patient comes in and they're like, thank you. You completely changed how I was viewing this birth, because I had no choice. They had to have a cesarean. And I'm like, let's make it beautiful. And
I just love that. It just brings tears to my eyes, because I had someone like you as my support person. Because my intention was to have a VBAC home birth. It was, I had a private midwife. And so it was the private midwife that actually was able to come into the hospital setting when we transferred to the hospital. And she then became like the support person. And she was the one who was keeping me grounded, who was keeping me coming back into my body and saying, okay, you get to choose. Right. So the doctors were coming in and out, and it was like, all of these things. And she was like, you get to choose, right? It's your choice. You get to choose around this and around this and around this. And you can ask for this, and you can ask for music in the operating theatre, and you can ask for the least amount of people in the operating theatre as possible. And you can ask for the, extended skin to skin contact. You can ask for all of these things. And I was like, I can ask for those things. And she's like, yes. So without someone like that, without someone like you, and I think that is just why it is so important for women to be able to tap into this community of support, whatever that looks like, doulas, midwives, osteopaths, like practitioners that specialize in birth and working with women in this way, because it cultivated an experience that was so drastically different from my first birth. We had the least amount of people, like literally, there was like hardly anyone in the operating theatre. It was like mind blowing compared to my first. My daughter was born to mantra playing over. It was dead quiet. All we could hear was the mantra coming in. It was skin to skin contact immediately. We were able to have open conversation with the OB and say that, we want to have, this was our experience with our first birth. We would like to have at the littlest amount of contact with our daughter as possible. So we want the OB to give her to us.
Yeah.
They said, obviously, because of they can't pass baby over the curtain because you're obviously opened up, but what they can do is literally midwife will be standing here and they will pass baby to midwife, and baby will then come straight to you, and the pediatrician will look at baby later because you've had a completely normal, no complicated birth, pregnancy, like you'll be fine. And so it was like that. She came to us immediately. They did the delayed cord clamping, and this was I had my first baby in the private system, and this was in a public system, this second one, and yet the experience was so empowering, so beautiful. But if you just looked at it on paper, you would think, oh my God, there would be a narrative immediately there of, oh my gosh, you poor thing, like, how devastating that you couldn't have the VBAC, and then you had to have the Caesar, and you had to have it in the public system, and like all of these narratives, would come up just on paper. But it actually was the complete opposite to that narrative. It was just the most epic experience ever, and so healing from my first, but just reiterates that importance of having access to people who, one, have the knowledge and the wisdom, and then are willing to pass that on and remind you, like you've said, let's make this experience beautiful for you, irrespective of what it's going to look like.
I'm going to bring it back to you, Kate. It was also your mindset.
Yeah.
You wouldn't have got there no matter what your birth support person if your mindset wasn't in a good place.
For sure.
Because you meditate, because you probably do meditation, mindfulness, even some gratitude. If you didn't have a practice like that, it's hard to get yourself. And that's why, I had a patient come in recently. She said, I just found out I'm pregnant, so you probably can't start working on me. And I'm like, yeah, we can. Yeah, we can. Because I want you to start doing mindfulness training, meditation, because we need to start doing that from word dot. So you're like, your credit in that birth, and I listened to your birth and go, that sounds like an amazing birth. And so well done.
Yeah, thank you.
That's great. Like, and I think that it sounded like a beautiful birth, and and
it impacts the relationship that women have with their children. Their birth can impact, it really does have a long-term impact. So something that is really quite fleeting when we think about the lifespan of a woman, like birth is this one kind of moment captured in time, and yet it can have this ripple effect until the day we leave this body. The woman that you spoke of who had the work on her cesarean scar, many years later, there's women I'm sure that you see who have pelvic floor concerns and they're in their 50s, 60s, and they had their children 30 years ago, right? And they just didn't have the support.
A lot of them have just been putting up with it for a really long time. And I also, like nearly every person that I see, postnatal mum who I see in the postpartum period, said postpartum a few too many times then, who has prolapse and incontinence. And it really bothers them, most of them. And nearly all of them who are incontinent were already incontinent before the birth. And they were too embarrassed, because when you've never had a baby before, people are embarrassed about asking for help, because isn't that just someone who's had a baby or is post-menopausal experiences? So I guess it's just changing the stigma around all of it as well.
Yeah. And having more conversations like this for women to tap into and realize that actually, so many other women are experiencing these things, and that they're unique. And that they're valid in their own experience, that there's nothing wrong with them per se.
Exactly.
Yeah. Yeah.
And they're not coming. I heard someone once say that we're not fixing things, because when we say that we're fixing something, it implies that they're broken. And I'm like, that is awesome. I love that.
Yeah.
And we're not. Like, and I'm sure your husband being an osteo, you know that one of our principles is that for us, we don't believe that we're doing the work. Yeah. We believe that, we might point your body in the right direction in terms of some treatment and bits and pieces, but for us, it's your body that does all the work.
Yeah. I think that was something that I spoke about with him a lot when he first started as an osteopath. He was working in a couple of clinics where they were very much wanting patients to be rebooked. So they wanted patients to be coming back, every 2 weeks consistently, forever, indefinitely. And he always really struggled with that, because he always said, the way that I've been trained and the reason that I wanted to come into this type of work was because I wanted to empower people to take control of their own healthcare. So if they're just if I'm making them reliant on me to keep coming back and seeing me every 2 weeks when they don't actually need to, they actually just need to make these subtle adjustments in their life, and, and that I can be that support person that they can keep tapping back into in the moments that they require. So that comes back to that partnership and that collaborative approach that we were speaking about earlier. Then that's what he sort of desired. But I think there's some organizations that it really is seen as a business and needs to make money. And yes, there's, of course, like if you have a business, it has to be financially viable, but also I think we keep needing to anchor back into that intention of why we're actually doing this work.
Yeah. And look, I've never been a practitioner that's like that. And I have people that come from other clinics and that are like that and work in my clinic. And it's interesting because it's a very different mindset. And they're told, you've got to book them in for this many appointments and so forth. The only time I do that is when someone comes in for birth.
Sure.
And I get so booked out that I will say to them, okay, well, how many times do we think we need to see you prior to birth, prior to the birth? And that's the only time I really do that, unless someone also because I get so booked out. But I say to patients, if we're booking 4 or 5 appointments, if we don't need them, we're cancelling them.
Yeah.
I don't believe people should. It's that whole find it, fix it, leave it alone thing. Once you've worked it out, you should be able to leave it alone. And if it's coming back, then you haven't really got to the root cause yet. Yeah. So I'm on the same mindset as your husband, and I've never worked in a practice that's been like that, but I know a lot of people that are in practices where there's a lot of pressure that you just have to keep rebooking. Some clinics will be, you see one practitioner for 5 treatments and then you have to see the next person. So there's never that dependency, but they just keep going through 5, and
just keep circling their way around.
You start the whole process over again as well. They're big clinics and they earn a lot of money when they do that.
Yeah, but I think it's just compounding the issues that we already have, where people feel, one, like they can't take control of their own healthcare and then seek out the support that they need when they need it, and just keeps people in this, in this just endless revolving door of the medical system, when actually they probably don't require it. No, so exactly. Much.
And over treatment's a big thing. And the second that someone comes in and they even are sniffing around at the fact that they've improved, I'm like, okay, I know it's been 4 weeks. Let's make it 6 weeks. Because I don't want someone to be, I'm so busy. I can't have people dependent on me. It's not just because I'm busy. I've never wanted someone to be dependent on me. I'm always pushing them out and going, okay. And sometimes they're like, oh, do you think? I'm like, well, look, if you want, we can keep it at that. But if you're going, okay, I want you to cancel it. I want you to reschedule it for 2 weeks. I don't want you coming in here and saying that you're feeling good.
Yes. And don't come back if you're feeling good.
And if in 2 weeks later, if you've got your appointment booked and you're feeling really good, I want you to cancel it. It's different in pelvic health, because someone can be having a prolapse and they're feeling really good, but they still need to continue to be working on their pelvic floor strength. So sometimes in those cases, I won't be saying to cancel. But if it is more a pain aspect, then I'm saying, if you're going really well, you're discharged. You can make appointments as need be. I don't want coming back.
And if you're working with someone like throughout their fertility journey or as they're approaching birth and then into postpartum, it's obviously that regular touch point, which is really nice, and that regular support as well. So of course that instance is different.
Especially if someone has a prolapse, they want that regular support. And if they're really stressed about it, even if the prolapse is going really well, they still need that time to have you reconnect. And because the more stressed someone is about a prolapse, there's some really good research that talks about the more stressed you are, the more your symptoms will bother you. And it doesn't mean that your symptoms are worse. It just means that they
bother you more. Yeah, I'd say that would be true for all.
Oh yes, for most aspects. Yeah, exactly. Yeah. So, you know, I love my prolapse patients coming in and me saying, you've been really, and they're talking about how stressed they've been and it's getting worse. And then you're looking like, you're actually better. And they're like, what? I want your brain needs to hear this. Yeah. It's better. And I'm like, but your nervous system comes back to the nervous system again. It's just making you feel like it's worse, even though it's not.
Yeah. It's like the brain's just still trying to catch up to the body.
Yeah. So, you know, some of those patients, they need regular check-in. But I love being able to discharge patients and say you can make an appointment as need be now.
Yeah. Amazing. Well, you're doing phenomenal work in the world. Thank you for your time today. Can we close by having you share your vision for women's wellness?
I guess what I really want for all women, I want every woman to be able to have pain-free sex and an incredible orgasm. I want them, if they choose to be pregnant, I want them to be able to enjoy that journey. And I want them to have the birth that they want, not what other people want them to have, but I want them to have that positive, beautiful birth that they're after. And then I hope that they can all just run and jump and play with their kids afterwards without the feeling of, you know, like bladder leakage or, you know, so I want them all to have a nice, healthy, pliable pelvic floor that works well. And
Amazing.
It's a very big, long-winded wellness.
That's great. Yeah. Love it. Love a big vision. Why not?
Healing one vagina at a time.
One vagina at a time. I love it. Where can people find you if they want to connect?
Yeah, so on my Instagram, and I have lots of helpful tips on my Instagram account. That's the Pelvic Health _osteo. If you're an osteopath listening to this, you might want to check out the Pelvic Health Institute on Instagram. That's where we have got all of our courses. And we don't just run courses with internal, we do a lot of external courses as well for preparing for birth and even learning how to address pelvic floor issues that are external. And then my 2 clinics, I've got one clinic in Kew, and that's called Eastern Osteopathy. And I've had that for about 10 years. And then in Hampton, I have the Osteopathic Pelvic Hub. So, and lots of osteopaths trained in pelvic health in both of those clinics. So the osteopaths working with me are lucky enough that they just get all my overflow. We don't want to wait the 6 or 7 or 8 weeks to see me. So yeah, they're beautiful clinics. And so that's where you can find me.
Amazing. Thank you so much. Until we speak again.
All right. Thanks, Kate.